Senator Murray.
Thank you, Mr. Chairman, and thank you to all of our witnesses for joining us as we look at the role primary care can play in addressing skyrocketing healthcare costs and improving health outcomes. Families across the country want quality health care to be accessible and affordable no matter where they live or how much money they make or what health challenge they indeed face. They want to know that breaking a bone is not going to break the bank and that a high fever won't come with a high cost, that filling a prescription won't mean emptying a savings account, that managing a chronic illness won't mean having to travel prohibitively long distances or manage exorbitant costs. And when it comes to keeping families healthy and care affordable, how we approach primary care is a key piece of this puzzle. Experts in Washington State have known this for years and have been a driving force for models that work to make primary care more accessible, affordable, and effective. Like Dr. Ed Wagner at the McCall Center in Seattle, who helped advance the idea of the patient-centered medical home. It's a delivery model where care is coordinated through primary care teams for better efficiency and better health outcomes. Having these primary care teams quarterback care in this way means giving them a clear view of the field, a patient's holistic health needs, a roster of their teammates, to the patient's other healthcare providers, and the power actually to call plays, tools for coordinating care and treatment decisions across the health system. In practice, what that means is that primary care providers can better understand how to keep all the different specialists and providers on the same page about which treatments and prescriptions and approaches are best for a patient's needs, and how to prevent treatments that are redundant or worse, counterproductive when used together. And they can better understand what barriers like cost or distance or language might prevent a patient from getting the care they need and how to overcome them. The result is care that brings down costs, not just by giving patients better, efficient care when they are ill, but also by doing more to keep them healthy. This promising delivery model was not only advanced in Washington State by the McCall Center, it was put into practice by one of our state's largest employers, Boeing. Boeing found that by delivering care that was more coordinated and personalized, not only lowered costs for patients by 1/5 by preventing expensive care like hospital admissions, they also increased access to care and improved their employees' health outcomes. Our state has continued to lead the way in implementing new ideas to improve primary care for patients across the country. And I'm looking forward to hearing today from Dr. Bennett, who is with the University of Washington, about one of those efforts. It's called Project ECHO for geriatrics, which takes a novel approach to better tailoring care and lowering healthcare costs for our seniors. The program sets up a regular teleconference for family medicine residents and others on their team in rural areas to learn from geriatric experts and consult on issues like which prescriptions are best for elderly patients, how they can help patients manage chronic illness, and what preventative steps can they suggest to patients at risk of dementia or seniors who are concerned about falling. By giving primary care providers access to experts on these issues, this application of Project ECHOS helps bring specialized care to seniors who might otherwise have to wait for weeks or months for an appointment and might even put off getting care in the first place if required to travel far from their home. Dr. Bennett, I'm very excited to hear more about this work this program is doing and how it leads to better outcomes and lower costs for seniors across the Northwest. Of course, while primary care providers can play a critical role in coordinating care and reducing costs, they can only play that role when people have access to care. In fact, when people don't have access to primary care, they don't just miss out on care that can improve their health and drive costs down. This lack of access can actually drive costs higher. Patients go to the ER for non-urgent medical care, or worse, without medical care entirely until non-urgent issues become urgent ones that are more expensive to treat, more debilitating, and more challenging to overcome. So while innovation in primary care is important, we must absolutely remember to focus on access to it as well and work to help people overcome barriers like cost and language and location. As we heard last week, community health centers play a critical role in doing that. They provide 27 million people across the country with affordable care close to home. So I'm very glad that Chairman Alexander has joined with me. We are introducing a bipartisan bill to ensure they have stable funding for the next 5 years. That's a very important step in supporting centers across the country that provide primary care to underserved communities. And as we continue to focus on the issue of healthcare costs, I'm hopeful we can find more common ground on issues like how to bring down skyrocketing drug costs so families are worried about on whether they can afford life-saving drugs like insulin, how to address surprise balance billing so patients aren't caught off guard by unexpected and unaffordable price tags for out-of-network care, and how to address President Trump's healthcare sabotage and lower premiums for families in the country. Democrats have a lot of ideas on how to do all this. We're very eager to make it happen, and I'm very much looking forward to sitting down with Republicans to work with common sense solutions to these healthcare cost issues we face.
Thank you,
Mr. Chairman.
Thank you, Senator.